This episode of Transmission Interrupted was recorded April 22nd, 2026. This is Transmission Interrupted, a podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETEC.
Hello and welcome to Transmission Interrupted. My name is Jill Morgan. I'm a nurse here at Emory University Hospital. And for those of you not yet familiar with NETEC, our mission is to set the gold standard for special pathogens, preparedness, and response across health systems in the U.S. with the goals of driving best practices, closing knowledge gaps, and developing innovative resources. NETEC works alongside and in cooperation with the CDC and is funded by ASPR, the Administration for Strategic Preparedness and Response. I am excited to talk to Dr. Alex Isakov today. Alex joins me from here in Atlanta. He is the medical director of the Emory Grady EMS Biosafety Transport Program. He's also a division chief of pre-hospital and disaster medicine and the co-lead of NETEC's EMS work group. I think for today's topic, we're going to be talking about World Cup prep, and there has been nobody that I know of that's more embedded in this than you, Alex. So welcome, and I'm looking forward to hearing more about everything having to do with World Cup and the worries of healthcare and healthcare workers.
Well, thanks for having me, Joe. It's always great to get on Transmission Interrupted.
So let's start with a little bit about this planning has been going on now for literally years. And what is your place in that planning, just as a quick overview?
I'm a frontline healthcare worker as an emergency medicine physician at Emory University Hospital, and I run a division of physicians that focus on pre-hospital care. And so, because Atlanta is a host city, our team has been working to ready agencies for a large number of visitors coming to Atlanta. And then, as you know, like you, I'm also active in the special pathogens community. And so also think it important that our frontline healthcare personnel, whether they be first responders or first receivers, are best prepared to manage a patient so that they can make best decisions for the patient, but also good decisions about protections that are necessary in caring for them safely and preventing transmission to others. I participate in Atlanta's host city medical committee, and this is among the things that have been considered in advance of World Cup.
How is World Cup prep different than anything else that brings a lot of visitors to the city?
There's a few things that distinguish it, Jill. I think the first is the duration of the games in any particular host city. In Atlanta, for example, they will be host to 8 of the matches. If you look across the United States, there are 11 host cities in the U.S. There are a total of 16 host cities in North America. And there are 48 teams and their fans coming to North America to play matches over the course of a month to 6 weeks. And it'll be in the middle of summer. It will be different than any other type of event that we've hosted here because the duration of the World Cup for over 1 month between June and July. And it'll bring more visitors from different parts of the world to all of our host cities than we might otherwise have had for a Super Bowl, for a World Series, or other types of mass gathering events that cities are ready to respond to.
Yeah, because it seems like most of the things that any big city might prepare for, like a sporting event or huge concerts and things like that, I can't imagine even, following Taylor Swift around is its own, I'm sure, mass casualty sort of prep thing. But, you think about those being largely US-based people. You might get an influx of people, but they're largely coming from the United States. And I can't imagine how difficult it is to do this prep when right up until the end, you're not even sure which countries are coming. I mean, is it decided even yet exactly who will be here?
They have 48 teams that are qualified from all over the world. And of course, the host cities are identified. Now, there are team home-based cities that I think have yet to be finalized. They know which 48 teams are coming, but, the fan base may go beyond the 48 countries that are represented, right?
Sure. And those 48 countries, some of them, I'm sure, all of them. We all have our own flu season. We all have our own strains of things. And then there are some countries that have some endemic diseases that I know are of a concern to us.
Yeah, that's right. This is part of what makes World Cup unique in that regard, is that you have visitors from all over the world coming to 11 different cities in the United States. And you're right, where there's different endemic diseases in these various, countries. The American healthcare enterprise, knows how to assess patients and does a very good job at managing their illness all the way through severe critical care. Frontline healthcare personnel, they do this in the United States every day, but they have increased likelihood of encountering diseases that they wouldn't routinely see because of the large number of international visitors that will be coming to the United States. Even if we pick one that's non-communicable, Jill, like malaria, we're all trained as frontline healthcare personnel to consider malaria on our differential diagnosis when we have somebody with a travel history and fever and constitutional signs or symptoms. And it's important to consider malaria in patients with a travel history, especially if they're coming from a malaria endemic area, because if you miss that diagnosis, for some patients, it can have serious consequences.
Yeah.
And so being in a World Cup host city or in a city that will attract visitors from around the globe, it's important to increase your vigilance for those types of illnesses that you might not routinely see day to day.
Yeah, I think about even some of the other ones. You mentioned malaria doesn't have person-to-person spread, dengue, yellow fever, even some of the other ones that I think we think of as Caribbean, like chikungunya and things like that. We have the mosquitoes to transmit an awful lot of things here, even if we don't typically have those pathogens. And I guess if you're coming a really long way to a host country and to a host city, I'm willing to bet that some of the people coming also may travel to other places that have nothing to do with World Cup, like our national parks, like Disney World and Disneyland and, the Grand Canyon. So there isn't a place in the country that really is excluded from needing to think about the concept of travel and symptoms and keeping your eye out.
Right on target. The people that are visiting the United States, Canada, and Mexico for World Cup are not going to limit themselves to the host cities where the stadiums are. This is something that, while you may have a concentration of people in those host cities, there will be people that will be traveling all over the United States who come to the U.S. because of World Cup, but are not going to limit themselves to that geography. So, everyone has to be a little bit more vigilant.
So I want to pivot for just a second, because normally, of course, we're talking about transmissible diseases here and infectious diseases, but there are a lot of other things that I think could cripple a healthcare system if we had some other things that can happen during these large events. Some of those, of course, Atlanta is very familiar with the Olympic Park bombing. I mean, that's still way too fresh in many minds here in Atlanta. But also, I think just what happens when you get lots of people together. We have people coming from the Southern Hemisphere where it's flu season. We have people coming with their own pathogens from wherever, but also enthusiastic fans and fireworks and just the kind of rivalry stuff that we would worry about with other injuries. And I just wonder, what does this look like in other World Cup events? I'm going to separate Qatar because I know that was a completely dry World Cup and probably a little different than perhaps typical of fan activities and things like that.
I think all World Cups are different in many ways, Jill. In the way that you say Qatar was unique. If you were hosting World Cup in Brazil, like was the case in 2014, the ecology there, the infrastructure there, it's just distinct from what it is in the United States. And so every World Cup host country is going to have unique elements that need to be managed. But there are also things that are common, like what we're talking about here as it relates to communicable and non-communicable diseases and readying the health system and the public health enterprise to be ready to detect those illnesses and to respond if needed, not just to clinically manage a patient, but if there's a need to isolate someone with a communicable disease or conduct case investigation and subsequent contact tracing, that those measures are in place. You mentioned some issues as it related to security concerns, risk for violence, risk for injury, consequences from alcohol consumption. And that's all real and needs to be anticipated as well. There's not a tremendous amount of data that's been available for us to review as it relates to increased demand for health services during World Cup. So there's some planning assumptions that have been made to anticipate increased numbers of people seeking care. I think for us in the United States, and because of the time of year that we're hosting the games, I think heat injury is something that we really should be on the lookout for and have mitigation plans in place. Maybe review protocols among first responders and first receivers about how to manage the most serious consequences of heat injury, heat stroke, for example.
Yeah.
I think that would be worthwhile. In terms of consequences of alcohol consumption or violence, most U.S. cities are prepared to manage patients with trauma and intoxication. We have robust health systems in all the U.S. host cities that should be able to manage that. If we start to consider issues around mass casualty management, that will challenge, really any city. But it'll be important then for first responders to have their patient triage guidelines top of mind, reminded how to perform life-saving interventions for patients in the field that need them, and then look at their patient distribution plans, and also recognize that in the history of mass casualty incidents, there's always a large proportion of people that self-refer to the nearest hospital for care. And so that's all part of the consideration for hosting mass gathering events as well. And cities take measures to prepare for that.
I'm wondering about some of the details of that. I think this idea of moving people around, like if need be, certainly hospitals outside of Atlanta or outside of any of the host cities would then be responding. And I assume that essentially the CONOPS that you might have in place for other things really get brought to bear with these kind of situations where if you need to offload patients somewhere else, EMS becomes just this incredibly strong network of agencies that can respond and move people around. It sounds like it would be a logistical, I'm grateful that there are people who are focused on just those logistics, because I think to the rest of us, that sounds like just a nightmare.
I think it'll be challenging for any U.S. community, depending on the number of casualties and the nature of the injuries that they need to manage. That's not an easy day for anyone if you have a large number of casualties that need management. You're right, the EMS community have a role in trying to mitigate the challenges, the consequences of that type of an incident. And there are frameworks that help to have those procedures, better placed, like the healthcare coalitions that are, funded by the federal government through the HPP or hospital preparedness program, contribute to communities' readiness and engagement of health systems. This concept of medical operations coordination to try and redistribute patients to where the resources are and away from health systems that are operating under surge conditions is an important concept to try and get best outcomes for patients. We know that health systems operating under surge conditions, there's a greater likelihood of having bad outcomes in health systems that are operating beyond capacity. So that those load balancing techniques are important. But, bringing it back to infectious and communicable diseases, Jill, for the transmission interrupted crowd, I think, podcasts like this is important to increase awareness about some of those illnesses that we talked about that we don't more routinely see, which is one of the risks of having a large number of international travelers come. You'd mentioned a number of them. We talked about malaria. We talked about dengue. I mentioned chikungunya as an example. Then there are also illnesses that are just perhaps more impactful because of the concentration of people that you have in places. And so while they may not seem that exotic, they certainly can be disruptive And when we think about norovirus and the importance of safe food and safe water and how disruptive a norovirus outbreak can be and how important it will be to have cleaning and disinfection protocols in place and isolation recommendations in place to mitigate that. We rely heavily on our public health partners for that type of guidance. Also, as you'd mentioned, there are people coming from the southern hemisphere where the flu season is active. And so in close quarters, you're more likely to have transmission of respiratory illnesses. And that can include influenza and it can include COVID-19. And we can't say measles is eradicated in the United States anymore. And so, there's risk, whether they're travelers from a neighboring state or travelers from another country. If they have been infected with the virus that causes measles, then they're, at risk for transmitting. It's the most contagious disease that we know. And when you have people at mass gathering events in close quarters, and, here in Atlanta, Mercedes-Benz Stadium, as an example, is an indoor venue, but it's not just the stadiums. It's going to local restaurants and going to bars, and going to, other places where if you have measles, you can increase the likelihood of transmission. And so something for us to consider.
Absolutely. So along those lines, Alex, and I guess just thinking about sort of to wrap this up with some good advice from you, I know that you have done a fair amount of traveling for this preparation. What's your advice to travelers, whether they're traveling for the World Cup or whether they happen to be traveling when everybody else is traveling around the country or internationally during this event? Do you feel like people should take more precautions or be extra careful, whether that's masking or hand hygiene, or what do you suggest?
Probably a few things. One, for vaccine preventable diseases, try to be vaccinated. I think that's good advice for all of us day to day. Certainly good advice for people that routinely go into areas where you're in close quarters with others. I think it's especially important if you have some underlying medical conditions that would put you at risk for more serious illness, even for influenza, because of age or some other underlying medical condition. So get vaccinated for vaccine preventable diseases is one great way to prevent transmission of infection and consequences. I think the second is if you're ill, don't go to crowded rooms and mass gathering events. If you have a fever and a cough, then you should just stay home until those symptoms improve. And, you can look to the public health authority about guidance when you're less likely to be shedding the virus or whatever else that made you ill. People come to enjoy the games and they're going to want to participate in all the social engagement, whether it's in the stadium or outside. If you're sick, probably stay home until you feel better. If you do have underlying medical conditions, then I think you have to also just follow the advice of your doctor about the wisdom of going into a crowded space where the likelihood of illness transmission is higher. Those are broad and general recommendations. I think if you have hand sanitizer available, always good to exercise good hand hygiene. I won't go as far as to say you should wear a procedural mask going into a mass gathering event. I think that's a personal choice for many.
No, I think it's a great answer, and I think you're absolutely right. Vaccine preventable, get vaccinated, absolutely number one. And I think hand hygiene, the number of times we touch our face, the number of times we touch other things and then touch our face, the odds of probably getting a direct inoculation from another human, of course, they're going to go up. You're in a confined space, at close quarters. But even if you're out in open air stadiums or traveling or in streets and restaurants that are open, you're still touching things. And then, unfortunately, what we do is we shove these pathogens right into our own nose, mouths, and eyes. And that's probably just as responsible as anything else for how we get sick. So it's a great warning to remember your hand hygiene, take some hand sanitizer with you, and then, at least wash your hands, please, when given the opportunity.
Yeah, I think that's right. Another thing we haven't talked about, but I think it's important in, readiness for mass gathering events and for FIFA World Cup 2026 is to be familiar with the identify, isolate, and inform paradigm. You can learn more about that at netech.org. But I think it's important, for all of us as frontline healthcare providers to be familiar with illnesses that are among those that the public health department want to know about, the reportable diseases. So we want to be able to identify them. We also want to be able to identify illnesses that would pose a risk to other patients or to us as healthcare personnel, as clinicians, or to visitors and bystanders. And so, going back to the discussion around measles would be a good example of that. We want to be able to identify a case of measles as a frontline healthcare provider, in addition to other illnesses, so that we can take steps to properly isolate that patient and apply an appropriate hierarchy of controls and personal protective equipment, for our own safety. And then alert the public health authority that we have a case of suspected measles. They want to know about that. On this show, Jill, we often talk about Ebola virus disease, Marburg virus disease, Middle East respiratory syndrome, all high consequence infectious diseases. But really, while it's important for us to be ready for them, we're far less likely to encounter a patient with one of those HCIDs than we would be a case of measles. And so it's important for us to just be reminded.
That's a great reminder. And I will say, in adult medicine, adult emergency medicine, we may not be used to asking a vaccination history, right? Because unless somebody's got an injury for which they might need a tetanus shot, we kind of can skip over vaccination sometimes. And we're more likely to ask that of children. But we have a lot of adults around the world who might be or under vaccinated and not immune to measles. And so it becomes something that we have to keep in a list of things that we're at least considering for them.
Yeah, just increased awareness about that, travel history. Dengue, for example, it's a vector-borne disease. So if we miss warning signs of a patient that presents with dengue and maybe didn't even consider it in our differential because we didn't consider that the patient recently traveled, even from a place like Puerto Rico or the USVI, we may miss an opportunity to intervene early and get a better result for the patient.
Absolutely. Absolutely. All right. Well, Alex, is there something else you definitely want to get across? Otherwise, I will thank you and we'll wrap this up.
I'll underscore a few of the things that we talked about before. I think getting vaccinated against vaccine preventable diseases is important for all of us as healthcare professionals, but just in the general population for our own safety, safety of our kids, safety of our friends and neighbors, and those that may have underlying medical conditions that we get a lot sicker. Two, I think identify, isolate, inform is a great tool for frontline healthcare personnel, to recognize illnesses that pose a risk to them, not just the patient, but to the healthcare provider, other patients, visitors, and bystanders. And then the third is there's probably some value in reviewing some of these non-communicable diseases just to increase your awareness and your being alert to them as a frontline healthcare provider. And that, that includes things like chikungunya and dengue as examples, or malaria, so you're better ready to recognize them. I think we should all be prepared to have a great summer and enjoy World Cup in North America.
I know. I'm really excited about World Cup. I've gotten more excited over this spring. I think it's going to be fun. I'm looking forward to it. And I'm also hoping that everyone will remain well. So thanks, Alex. It's been a pleasure to talk to you. We're going to be doing several episodes about World Cup prep and things that people should be concerned about or looking out for. So I really appreciate you kicking this off with some very reasonable, doable warnings. Like, if you can get vaccinated against it, go ahead.
Absolutely. And, don't forget to have fun.
That's right. That's right. Well, thank you so much. We really appreciate all of you joining us today for another episode of Transmission Interrupted. We hope you'll join us for future episodes on this and a wide range of other topics, from healthcare worker safety to personal protective equipment, infectious diseases of all kinds. If you have any questions for NETEC or ideas for future shows, please feel free to contact us at info@netec.org. That's info@netec.org. You can also find us on the web at netec.org/podcast, where you can also subscribe to future episodes. So thank you all for joining us, and we'll see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, a NETEC podcast, produced and edited by Benjamin Madsen, with additional support provided by Britton Clark, Veronica Lavaro, Jason Noble, and Lisa Stone. Special thanks to our guests and the subject matter experts at NETEC for their insight and guidance. This podcast is supported by the Administration for Strategic Preparedness and Response. For more information, tools, and training on special pathogen preparedness, visit netec.org. And don't forget to subscribe, rate, and share the show on Apple Podcasts, Spotify, or wherever you get your podcasts. Thank you for tuning in to Transmission Interrupted.